Good evening, everyone, and thank you for attending another ACAM's eMedTalk. Today's webinar is Perspectives on Losses and Gains in Connection to COVID-19 with Dr. Heather Servati-Saib. Attendees are encouraged to submit questions using the chat box, and questions will be addressed throughout the presentation with the longer Q&A at the end. So just want to let everyone know this is going to be an interactive format, so quite similar to Dr. Gomanak's, where questions are encouraged to be asked throughout the presentation regarding the topics discussed from Dr. Hendon, Dr. McBride, and Dr. Servati-Saib. So let's talk about the moderators now. The moderators for today's webinar are Dr. Howard Hendon and Dr. Pat McBride. Dr. Hendon, president of the American Academy of Physiological Medicine and Dentistry, AAPMD, is well trained in all aspects of general dentistry, and since the 1990s has pioneered the relationship between dental issues and whole body health. Sharing that same passion for a better understanding of the connections between craniofacial pain and whole body health, Dr. McBride has relentlessly pursued improvements in the fields of dentistry, respiratory medicine, and dental sleep medicine. Over the course of 35 years as a full-time clinician, Dr. McBride contributed greatly to the development of interdisciplinary care model delivery systems used by physicians and dentists across the globe. So it is always an honor to have you both on here. And Dr. Hendon, I'll pass it off to you.
Hey, thank you, Jordan. And I just want to remind everybody, this is a Collaboration Cures webinar, and it's a collaboration between ACAM and the AAPMD. I want to introduce my my co-host, Dr. Pat McBride, who also is a board member of the AAPMD. Hi, Pat.
Hey, everybody. Nice to see you.
Pat just shared with me that she works for Inspire Medical. They do implants in order to help people, that are placed under the tongue to help people breathe better. And she's back at work and did two cases today. I'm going to just find the slides here. So I think this is one of the most important webinars that we've done in a long time. We have as our guest Dr. Heather Servati-Saib, who is a psychologist from Purdue University, and Pat came to me and said, we have to have her on a webinar because she has such important information. And after speaking to her and reading a little bit about what she does, I absolutely agree. And you're going to love the conversation we're going to have. And Pat, I was telling Heather before that I was reading two articles. One was how people are going to be more concerned about self-care and about their health and want to do more for their health in the future. Mm-hmm. And the other is the stresses that people are having and how they're responding to it. Some people are going to be afraid and they don't want to go out, and they're protecting themselves. And other people are saying, this is really a crock. I don't need a mask. I don't need anything. It's not a big deal. And both people are really suffering from the same stresses and fears. They just express it in different ways. So why don't we go through the announcements, and then we can get right on to the discussion. And what we decided to do for tonight is really not have a presentation, but more or less a discussion. And we encourage you to type your questions in so that you can participate in the discussion and share your thoughts and your feelings. So, Pat, you want to walk us through some of these announcements?
Sure. We have coming up a number of really good webinars. On June the 17th, we have two really important life and health coaches who are going to be presenting with the Sharp Again program, and that's Nancy Weiser and Lisa Feiner, and they're going to be on to talk about also self-care and about how we can deal with our lives moving forward in changing society, and how we can take better care of ourselves and those around us. And that is also going to be followed by Dr. Kathleen Carson, who is really one of the foremost experts on the use of CBD and the in medical care as well as in dentistry, in order to better understand how patients are self-medicating using things like CBD, and to be more effective care providers so that we can make sure that patients really understand what they're doing, why they're doing it, and how we could possibly help them, given that this is the choices that they're making. So that's going to be on the 17th and the 24th of June. So coming up this next week.
I just want to add that Sharp Again Naturally is an organization founded to educate people about the reversible causes of Alzheimer's, dementia, and memory loss. And more and more information is coming out that stresses and chronic infections and toxicity, the combination of all these things together, are really what causes brain inflammation that ultimately leads to Alzheimer's and cognitive loss. So this webinar tonight deals with one of the reversible causes. And then on June 30th, Pat?
Oh, I'm a huge fan of James Nestor. He's an author who's written many pieces and has been published in numerous publications, books, art, magazines, and whatnot. And he's got a new book out called The New Science of the Lost Art, Breath. And it has been universally embraced by medicine and dentistry alike, and by psychologists and psychiatrists, understanding that breathing is at the source of many people's issues, and that how we can help them with their breathing can actually help dissipate some of the inflammation in their systems and help to reestablish some level of homeostasis, so that whatever else we're doing for the patients can also help them to live better and healthier lives. So it's an absolute coup that we were able to get Mr. Nestor to come on. We were very excited. It's going to be huge. And so both our physicians and our dentists are very excited about having him, as well as other ancillary care providers that run the whole spectrum from physical therapy through psychologists and psychiatrists as well. So we're looking really forward to having him. And that's going to be followed on the 23rd by...
Well, this is like a week before. And we just added this webinar. And this is a webinar featuring one of the leading integrative physicians in the country, Dr. Stephen Bach, who happens to be in New York, who is world renowned for treating Lyme disease and other chronic diseases, and Susan Levin, who happens to be an advisor to the ACAM board and on the education committee, along with Pat. And she doesn't know whether she's a health coach or a medical detective, but what she does is she interviews patients and she gets all the information and serves as a go-between between the patient and the doctor. And between the two of them, they have gotten great outcomes, reversing people with longstanding chronic Lyme problems. So learning how they work and they work together would be very valuable for all healthcare practitioners. That's on June 23rd. And these are a list of some of the organizations. We hope that everybody on this webinar is either a member of the APMD or ACAM, or a patient of somebody, of a practitioner who is. And so in order to move our collaboration cures movement forward, we don't want you to watch, we want you to join and participate, whether you're a practitioner or a patient. And so I'm going to, Pat, why don't you tell us a little bit about how you met Heather and the role she served in your life, and then introduce her, and then we can begin this great discussion.
Well, it's kind of a long story, but we'll make it the synopsis is that while I was working on part of my research for my PhD, I was dealing with emerging adults and bereavement. They use social media to help understand and channel their energies towards the Facebook pages of their deceased loved ones to try and help form some sort of an ongoing connection and continuing bond to help them process their losses. And I reached out to Heather and thinking not in a million years would this woman ever reply to me. And she got back to me and helped me with my research, introduced me to some really wonderful people, including Dr. David Balk, who was actually my outside reader for my dissertation, and really started me down the road of how do I understand thanatology or death studies, and to the greater application of my the fact that I treat patients, that are in very various phases of sleep apnea, respiratory issues, health crises. And how can I use that same level of knowledge and bring that forward into what I do to help the living move forward and to have better lives? And so if not for her, I would not be sitting here to talking about this tonight. So I owe her a huge debt, and I think you will learn a lot from her and be just as engaged as I was from the moment I met her. So I want to introduce her. She's a licensed psychologist and professor of counseling and psychology at Purdue University, and she's also serving and as a new job as interim associate vice provost for teaching and learning. Her research work is focused on the areas of adolescent and young adult bereavement, suicide, social support and grief, and the use of loss as a broad model for conceptualizing significant life events. And this is huge, this whole idea of loss gain theory. Dr. Sevadi serves on the editorial boards of 4 death-related academic journals. She's the past president of the Association for Death Education and Counseling, or ADEC, and received the ADEC 2013 Death Educator Award. She's currently co-editing the 3rd edition of the Handbook of Thanatology, which for people like me is like a Bible. So please, without much ado, welcome Heather, and we really look forward to having our conversation tonight.
Thank you so much, Pat. Thank you for Howie as well. I'm really glad to be here. I think as you described the work that I've done, I mean, the topic that's most relevant to us tonight is really the gain loss framework and really thinking through life events through that lens. And that is what the work of my research team and the work with my students, really what we have done. And for us, it's really about how when you face a life experience, oftentimes as human beings, we have the tendency to see them very dichotomously. There's a life event. It's either desirable or it's undesirable. And what we really challenge in our work is the idea that each life event has probably both losses and gains connected with it. And that the impact of any one experience that we have can probably be assessed and considered dynamically through looking at the combination of those losses and gains. And so with that in mind, if we think about the current pandemic, we really have a unique reaction that each person would experience because there will be unique perceptions and unique, primarily what we would focus on now in terms of understanding the real depth of the responses is the more losses people experience. So in the face of the pandemic, some will have many more losses or different kinds of losses, different nature to their losses than others. And the more loss that people experience in connection with a pandemic, the higher level of grief that each person will have. And so when we think about grief, it's often, again, something very narrowly conceptualized in US society as an experience that is connected with death losses. And for us and for the work we do on my team, loss is broad and therefore grief is broad. It is a multidimensional response to all types of losses. And I think there's another layer of complexity there that I would want to highlight, that often when we think about grief, we think that it's equal to sadness. And it's really not, actually. Grief is not equal to emotions. Grief includes emotions, sadness being only one of those emotions. And grief also involves cognitive reactions, it involves physiological reactions, it involves social reactions, it involves spiritual reactions oftentimes. Part of what makes grief so overwhelming is that it hits on all of those areas of our lives, and so it can overtake us in that way. So if we think about the pandemic, and I know we can have, of course, more conversation about this, but I mean, there's going to be losses that are related to community, losses related to physical workspace, to routine, to structure, to a sense of productivity, losses related to the freedom of movement, and even more tangible losses, of course, related to income. access to resources and sort of planned activities or celebrations, things that people were looking forward to, things that are very important, even rites of passages. We think about young adults and youth in terms of the graduation ceremonies. We think about events like marriages, births. I mean, the losses connected to those life experiences are real, and the grief related to those losses is also real. In the face of the pandemic, now we're facing additional loss related to the anti-Black violence and the heightened sort of awareness or spotlight that we see now in U.S. society related to violence against Blacks. And it's just intense on top of a pandemic where there is already so much racial disparity in terms of mortality. And of course, we know long-standing sort of health disparities on top of that. So my hope, of course, is that in some ways there are elements of gain that we will see or can see in some ways related to the pandemic. Those gains will never, ever outweigh the losses. That's not the idea or what I would ever suggest. But the idea that life is very complex and all life experiences are complex and dynamic. So is one of the things that we could see as a gain, more time with family, opportunities to reflect on our lives, greater appreciation for life and the fragility of life. So those are some of the potential opportunities that might exist. A less busy existence, perhaps, if that was a real part of how we functioned in our work and in our personal lives. And then I think, no, go ahead. Good.
So for some people, having free time to reflect may not be a good thing. They things will come up that they had buried for a long period of time. But many people on the call are either some kind of health practitioners, and one of the reasons for having you do this is people would be coming into their office saying that I'm not sleeping well, I have fatigue, and they're having maybe the physiological effects of grieving about the losses from the pandemic. And I would hope that by the end of this your presentation that these practitioners will have certain insight about how they can identify that part. So I would like to start by asking, because you're on a college campus, I have two grandsons. One actually goes to your competing school in Indiana, and one starting college. And he loves, my older grandson loved being away of college. He met new friends. They do a lot of group planning, business planning. Now all of a sudden, he's not in school anymore. He's back home with his parents, and not only home with your parents, you're locked in the house with the parents. So he's like going back to his childhood. And some kids are acting by being sad and being depressed, and some are angry and irritable. And what has been your experience? How many students are at Purdue?
We have almost 45,000 students at Purdue in terms of our main campus, grad and undergrads.
When they're there. So now 45,000 students are back home. And do you follow up with them and see how they're coping, or what have you found? How all these 45 students are dealing with the pandemic? What's the range of things that are occurring?
Well, as you spoke to, I mean, it's a very broad range in terms of students' experiences. We think about students overall, and if we think about it even in the spring when everything shifted so suddenly, right? That's when we really heard about it. That's when they really were in the throes of all of that shifting and changing in their lives. And I really did hear from them part of what you're talking about in terms of what is happening developmentally while you're in the college years. You are oftentimes away from family. You often are building new connections with friends and with those who think differently than you and push you in terms of your values and your understanding of the world. And there is this sense of growth and moving forward, and personal development, and being back and going back to a home sort of setting. They really did. I did hear from many of them, they felt that they were taking a step backward. I would also say that some of them, even the seniors, because I reached out to the seniors a good bit in terms of what it was they were experiencing. And some of them were very, very sad about graduation and not being able to be a part of a graduation ceremony, for example. And some of them were like, it's a piece of paper. I mean, I don't really, I'm more sad for my parents because they wanted to see me walk across the stage. Some students talked about how they'd saved their very favorite courses until the end of their college career, and now they're no longer able to be involved in this professor they look forward to having, this particular topic they looked forward to learning, and they're still learning it. They're still interacting it with the faculty member, but it's just in a very different way. But then there were also students who talked about going home and being able to interact with their pets that they had really missed, especially the first year students, maybe in some ways. So then there's so much diversity. Right. But then we have students who, for example, identify as part of the LGBTQ community, and their homes were not a safe place for them to go back to. And yet that is what they had to do. Of a large range, as you alluded to, Howie. So
yeah,
I think that there's a commensurate relationship between the whole idea of launching, going off to college and launching, taking that next life step, and then this is a perception, and it's all about perception, and your perception is your reality to a large extent. And so for the parents, it's not like the kids failed to launch, but for the kids, it's like somebody put a truck at the end of the launching pad. So they can't launch, and they can't. And again, I think you're correct in the fact that I see, even with the young adults that are in the neighborhood now that are back, it's like they are constrained by, you are trapped in the house with your parents. And even as teenagers before COVID, you had a chance to have more freedom away from the home. You had a place to land, you could come home, but you had a part-time job. You had, all of these things that gave you autonomy and allowed you to grow and develop and become, start walking down the path towards who you're meant to be and not who you think you should be.
Yes, very much so. Well put.
I have another question for you. Is it possible, do you believe that there are people who are being affected by the pandemic? Everybody is, but aren't in touch with how much they are affected, and they assume that everybody around them is just behaving badly, and nothing has changed in their life?
I mean, I think it's quite possible. I mean, and I think that goes along with perception again, right? In terms of the variability of people's responses, but there could be some people who experience very few losses in connection with it. I think part of the issue that can be very helpful, and we spoke about this a little bit before, is that we really do have to be very clear that everyone will respond very differently. Their perceptions will be different. And even if their perceptions, even if they might list the same losses, the grief connected with those losses will be very different. So we grieve uniquely based on who we are as people, how we generally cope with challenging life events and life experiences is reflected in how we grieve losses, how we grieve death losses, how we grieve non-death losses, which is what we're talking about here. Although we're also talking about death losses. I mean, our focus so far has been primarily non-death losses, but of course in this pandemic we have many death losses, and it's a really interesting sort of. I did a grief group recently for campus, and we had a really powerful conversation during one session where we were talking about most of the individuals in the group had a death that was not COVID related, but one member of the group had a death that was COVID related, and it was sort of this disenfranchisement every way like the person who had the death loss that was related to COVID, it was like, oh yeah, well, you know, we're in the middle of a pandemic of, you know, you had a death related to COVID. And then the other people were like not recognized, their death wasn't recognized because it wasn't COVID related. And it just, you know, it's just a time where there's just so much loss, you know, so it can be easy for people to say the only grief here is death loss grief, when really there's a lot of other layers of grief as well. That's not to minimize or to try to at all equalize the grief related to death to grief related to these other losses. I know college students who have talked about their struggles, for example, and the things that they have missed have been shamed in a way. I'm not on social media, but I learn about these things, sort of shamed on social media about the extent of their reaction. And I think there's just no place for judgment when we talk about grief. I mean, there's so much of it out there in our society that part of what we need to do is to be champions for this sense of the uniqueness of everyone's response. Grief is unique. There is no linear path that is right or appropriate or correct. Really, grief is about sense making. It's about moving and living in the world now that these losses have occurred. It's about integrating them into how you understand the world now, how you understand yourself now, that these losses are present. And we can't know, you know, will our society be the same, right? We talk about, oh, you know, this is sort of the new normal. I mean, what does that even mean? I mean, you know, are we preparing for the new? We're preparing for the new future, and what that looks like and what it will mean in a way, I think, existentially for our society. Will we reflect as a society and think about how we move and be in the world?
Heather, before we went on the air, I was telling you the story that my mother lost a sister to the Spanish flu in 1918. And then her and a family, and a lot of people from that generation, because I don't think there was any family that wasn't touched by some loss, because there was so many deaths in our country. And her belief after that was you had to watch and take very good care, because if you got sick, the medical establishment wasn't going to be able to cure you. You could get sick and die. So even when I was 50 or 60 years old, she always made sure I buttoned the top button on my coat so that I wouldn't get a chill, or and got enough sleep. You look tired. How are you getting enough sleep? And then fast forward over the last 100 years, we discovered penicillin, a lot of other antibiotics. And then we got this attitude, whatever came along, there's going to be a drug or a cure for that. And we sort of gave up taking charge and ownership of our health. And now, all of a sudden, this is like a revisit. It's almost 100 years later. And we're revisiting, maybe not to the same effect, but we don't know because the pandemic hasn't played its full course yet.
Right.
But these things really not only shape the moment, but they shape our future. And would you relate that to your loss gain theory, that we can take the suffering at the moment, but maybe reclaim taking charge of our health and taking better care of ourselves? Because something like 80% of the people who die because they have some condition. And the number one condition is obesity, which is a reversible disease.
I think you're speaking to where I was going. I mean, it is about what will be the sort of broader existential reflection. Will there be some of that? And will there be places where we act with more conviction than we have in the past? I mean, to me, in some ways, will death be more discussable? I think that's a really critical sort of point for us. I think death needs to be talkable, right? I think those issues need to be discussed. We need to be able to move toward those conversations so we don't become complacent as you're talking. I mean, because we will be more reminded of the preciousness of life, and that we have points of control, and yet we have points of not having control. I know one of the things that I was looking at in terms of just reminding myself sort of what is it that makes a difference as people cope with disasters, cope with these such heavy, challenging life experiences that society faces, that the world is facing now, clearly. And one of the patterns, talked about issues of control. What do we have control over? What do we not? And when we're in the midst or moving through a disaster, where are our points of control? Where are our opportunities to take control? We can't control this pandemic. What can we control? And how do we use that as a way to help us to cope? And then coherence. What can we make sense of? How do we make sense of it? Which is what I was speaking about earlier in terms of grief. And then connectedness. We know actually one of the best predictors for people coping in the midst of disasters and situations like the pandemic is being connected with other people in very genuine and very real ways. And we're in the midst of a disaster where we're not supposed to do that, which adds this unbelievable challenging layer of we need people, and yet we can't be interacting with people in the same way that we need to be able to cope.
Well, I think part of, would you not say that there's a couple of issues that there is a sense of overall loss for the life as we knew it,
Yes.
Of course. I mean, the world wars do that. Any kind of pandemic does loss of life. So we grieve the life that we perceive that we have lost. And that, so we have to try and, as individuals and as providers and as people dealing with patients who are coming in who can't articulate what they're thinking or feeling. And that is huge because people don't articulate their loss. It's like there's something wrong with you.
Yeah.
If you're doing that, it's like you're a bummer or you're a downer or something. And that's, I think we need to invite the conversations to some degree and to be able to steer them away from, okay, so this is yes, we have lost part of the world the way we once knew it, but how can we create something out of it that is something that we can live with?
Yes.
And how do we redefine ourselves in this new space?
And
Yes.
Pat, the other part of that is not only do people feel uncomfortable talking about it, people feel uncomfortable hearing about it. Many years ago, about 20 years ago, my younger brother died of brain cancer, and I was really sad. And I have a lot of friends, and they said, "I want to make you feel better." And I said, "I don't want to feel better.
No.
I need to be sad. I'm very sad, and you can be my friend. Don't tell me you want to make me feel better." But so it's not only the person who is going through the loss who feels uncomfortable talking about it, and maybe one of the reasons is because people don't want to hear it. They feel uncomfortable.
Right,
So,
it's their comfort level that's for sure being challenged.
And so I think one of the best, if you can help give us some guidance, how do we become a better listener and deal with our own discomfort about hearing people share their losses?
Well, and I think one of the major pieces of that is acknowledging that we feel uncomfortable. I mean, not pretending that we don't, right? I think oftentimes we think for anxiety about death and grief and loss issues, we should just be able to eliminate it. Like we shouldn't have it, when really it's quite logical to be anxious about death. I mean, there are a lot of reasons why we would be anxious about death. The challenge is really acknowledging, recognizing, owning, and then using that anxiety to recognize the importance of being present with others in the midst of it. Not to pretend that it doesn't exist, not to try to push through it for ourselves, because that will then just make us want to try to push it forward through for others and pretend that it doesn't exist. I mean, recognizing it, owning it, facing it, using it to be present with someone. I know that sounds very counterintuitive, but it can be this meta sort of level of, I'm feeling really uncomfortable right now. This person is talking about something that's very sad. It's very difficult. And yet I can make a difference for them here. Like, this is a real place where I can make a difference if I can be present and focused and open to what it is that they're sharing. I can help them in a holistic way, right? Not just in a physical way, but in a whole person kind of way, and in a way that makes such a difference. So much loss is disenfranchised in the world. It is not acknowledged. It is not recognized. It is not allowed. And that allowance is so powerful. And so you talk about how can we be better listeners? A lot of that comes from knowing that it's difficult and then still moving through it to be present with people. If we go back and talk about the research with young adults that we have done, one of the times that really struck me in this way was a young woman talked about how her friend came to her house after her dad had died and sat with her on the couch and said, "Tell me everything. Don't hold anything back." And basically, I want to hear it all, and that may not be something that's possible in every work setting, every moment, every day. But even 5 to 10 minutes of listening to someone who is grieving, whether it's death related or non-death related, that attention, that allowance, it's really powerful for people. And there are some cultures who believe you have to tell your grief story 100 times before you really move forward in your grief. The storytelling, the ability to vocalize is actually contributes to people's ability to cope. That expression in and of itself can make a huge difference for people.
I think one of the things that a lot of us are concerned about is that semantics matter. So I never use the phrase social distancing because I don't ever want to be socially distant from anybody. Physical distancing is one thing because it's a necessary evil, but the problem with that is that it is, again, counterintuitive, and it's asking us, it's dehumanizing.
It is.
So there isn't a single individual who is not dehumanized by this experience, and it's asking us to be something less than what we are as human beings. So how would you apply loss gain theory to trying to help somebody with understanding conceptually and practically the whole idea of physical distancing and how it dehumanizes us and makes us feel that we are less than what we are meant to be, because we're basically social, touchy-feely creatures. That's what we are. So it's, I'm very interested to hear what you have to say about that.
Well, it goes back to the importance of connectedness, right? And so some of the losses we're experiencing are that more whole kind of interaction with people. It's the loss of, I guess one of the ways I would think about it is it's the narrowing of our connection with one another such that it is almost solely transactional. I mean, that it's all about the exchange rather than the sort of being together and being wholly, as you say, human with one another. And I know before we started, we were talking about how even just the masks can be uncomfortable, even just all of that separates us from one another. And the loss is there in terms of the separation of human connection. It's really significant. So how do we be intentional about capturing some of that again? What are the small ways that we can work into, even as we start to go back to work, the human part of things? How can we make sure that we're asking more personal questions of people at times, right? How are we sharing little elements of ourselves with those that we're working with in a way where we can try to recapture some of that genuine connection with one another and get some of those gains back, not just for the patients that we work with, but for ourselves too, for those interactions to be more human and more real. And I think it's going to take some intentional focus there. because there's so much discomfort in the way that we even have, if we are physically present with one another, there's so much challenge, so many literal sort of barriers in terms of our ability to connect.
Right.
Mm-hmm.
Do you think there's not a potential for young children growing up in the midst of the pandemic, if it goes on for, let's say, 18 to 24 months, to become phobic of the real world, being afraid to go outside, being afraid to take their masks off, being afraid that they're going to die, sort of deal? That I have a huge concern about that.
I think it's a reasonable concern.
With young people, with the little kids.
Yeah. So and I think it's something to talk about. Mm-hmm.
Somebody told me a story that Asian babies now they have masks on all the time, and when the parent goes into the bedroom and checks on the kid and takes the mask off, the kid starts screaming because the mask is normal. Not having a mask becomes abnormal. You know, I think that a little while back, if you walked into a bank with a mask, people were afraid. Now, if you walk into a bank without a mask, people are afraid. So the world changes. But so we have a dental office, and now in our dental office, people come in, and our first contact with them is, even before they come in, they have to have their temperature taken and fill out a form that they don't have any before we even greet them. When they come into our treatment room, they have a mask on, we have a mask on, we have a shield, we have a gown, we have a hat, we have booties, we have all these things on.
Yeah.
So already there's a barrier, and because these are all new routines, it's hard to have. First of all, there's less time. It's hard to have conversation, but from what you're saying, it's really important that we find time to listen. You know, everybody says, "How are you coping with this pandemic time?" Everybody asks that question. It's like when people say, "How are you?" Do they really listen? Mm-hmm. So I think because we give up touch and other ways of communication, we have to try to be better listeners and listen with intention, because a lot of us don't really listen with intention. We ask questions that we really don't want to. When we ask, "How are you?" do we really care how people are?
Yeah. Well, and I would argue actually that one of the ways that can, and it sounds very, very small, but when you might ask someone that question of how they're doing, and they might share, you know, a challenging sort of element, even to just throw out to them the idea of, yeah, there are a lot of losses here. We've all experienced a lot of losses. You will find that even just raising the concept of loss can be very normalizing and can be very validating, because it is pathologizing, right? It is a very sort of palatable, very understandable way to conceptualize the difficulties and the challenges that are happening. I think it's very confirming for people to hear someone reflect back the concept of loss. And I know I'm biased because it's what I do, but I've seen it so much where people go, that is what I am experiencing. I am experiencing losses. And then there's ability to really talk about, then, you know, grief is broader than death. It really is connected to so many of these loss experiences that we're having.
We have a lot of patients in our practice who have been patients for 30 years or even longer. So we've been through a lot of life experiences with them. And a number of years ago, I read this book called Validation Therapy, written by somebody who was a social worker in a nursing home. And her parents ran the nursing home. Then she went off to school, and she came back, and a lot of the things that people were doing were she knew them when they were younger. And the book really impressed me. When my mother was in the last stages, she had Alzheimer's for 8 years, and it really bothered me. And then I realized I was suffering more than she was, because she wasn't really suffering. So, and I read this book, and I would go in and I visit her, and I would talk to her, because they say, well, having a conversation is good. And I said, no, I read this book about validation therapy. And in the book, it says a lot of people linger on in this life because they need validation for their life. And I said, let me tell you why I think your life was so important and how many people you touched. And I sat down, I told her about children, grandchildren, and all the things. And then and then I drove home, and when I got home, my mother's aide called and said that she passed away right after I left.
Wow. Wow.
So
Yeah.
I think validating anybody's feelings, because especially with people with chronic disease,
Yeah.
they go from doctor to doctor, and they lose hope that they can be better, but they keep trying, and just to validate their feelings, because you can't see fatigue, you can't see pain. There's no rash, there's no fever, and sometimes they're not even believe that they're suffering the way they do. And maybe it isn't organic, maybe it isn't physical, maybe it isn't mental or emotional, but it doesn't make the pain and the suffering any less.
Of course not.
So true. And I think then that becomes like it's a disenfranchisement external that then can become internal, and they can disenfranchise their own experiences.
Do you have any thoughts or feelings for, we have, in our profession, I mean, my world spans medicine and dentistry. So I have colleagues on both sides of the fence. I have some of my primary care colleagues are still not back to work. Many of the dentists that I know who don't own their own practices, who are employed dentists, for instance, for other people. Lots of folks sell their practice and are employed by other people as time goes by. But this is essentially, and one person on here said something that I heard actually today from a physician friend of mine who said, I have no idea of when we're going to reopen. I have no idea if I'm going to be able to work. I have no control over this. My career is in a coma. I love my family. I'm spending time with my wife that I didn't spend before. I'm probably walking the dog too much. I personally am definitely guilty of walking the dog too much, especially when I was furloughed for, almost 3 months. So, I mean, I get that, but I knew at the end I would be going back to work.
Yeah.
I think we have folks that are here that are looking and searching for ideas that you may have that could help facilitate them to try and make a gain out of this sort of situation. And what would you suggest? Do you have any thoughts at all about that?
I mean, the gains are going to be very unique to each person. I mean, I hear some of the, it is possible that I heard gains there, right? I heard gains in terms of connection and relationship potentially, but then that also requires a sense of, not also minimizing the challenges with that, to be interacting so much with the people within your household if you are with them. But then there are also people who are never able to be with others. And there's a lot of challenge there as well. I think it does, there's not going to be any sort of quick fix to it, right? I wish there was, but it's going to require, I think, a sense of experimentation in terms of how we look at our own lives and what it is that we can try and sort of use an experimental sort of strategy around trying different aspects, different activities. Even walking the dog, I mean, walking the dog too much, that does give you it's more exercise in terms of a gain, but that's very surface level in a way. So, and as Howie said, the reflection itself can be a challenge in terms of sometimes in these kinds of situations too, there can be unresolved grief from other losses, prior losses, so much time to think about life, and reflect on life. We know actually, but it's going to vary by person, but there's a good bit of research on expressive writing being very beneficial if that's something that people have tried before. I think we have people who, I've heard stories of individuals who thought about things they used to do and used to enjoy and have not done those things. Even students actually, when they went home, began to engage in activities that they were not able to do, but were able to do once they went back to their homes.
Mhm.
Yeah.
And would you say that, and I think it might be now a kind of a natural segue to say that where we are in our lives, where we are in young, middle-aged, older adult, where we find ourselves in this life, the impact of these kinds of massive individual losses are going to be different, and we're going to deal with it in a different way based on where we are in terms of our age and stage. Would you say that?
Oh, yes, absolutely. I mean, there are different life elements that are operating, right, at each of those places. Even if we think about death anxiety is more present, actually, the research would argue, in midlife than it is younger and even older. It's kind of a curvilinear sort of relationship in that way. When there are different elements of developmental focus in terms of productivity versus a time where so much of life has been lived and there's much more of a process of reflection across the whole lifespan. Some of the validation sort of piece that Howie was talking about, and a sense of life review, right? And what this means then in terms of moving maybe toward retirement, if someone is older. But then we're thinking about how, this lack of being able to engage in work and the economic losses that we're experiencing right now on top of all of that, those are all real elements too. Development is not just about, young. It's not just about youth. Development is all across the lifespan. Absolutely.
Heather, when we reopened our office, one of our first patients who came in was a woman in her early 90s. And she had just sold her house that she lived in and moved to a assisted living facility. At the same time, COVID struck, and now nobody could come visit her.
Yeah.
And she came in because she had pain in her mouth, and it turned out that she was always very meticulous taking care of her gums, and all of a sudden she wasn't. And I said, "Well, it's really, you don't have an infection." I said, "You're not brushing teeth." I said, "Well, I am." She says, "Well, maybe I'm not taking as good care of myself as I have in the past." And I think that one of the things that happen when people are grieving, they don't take as good care of themselves. They're less motivated. I don't know whether there was an article in one of the European journals that said they're finding that teenagers are suffering from the loss of the ability to experience pleasure. They become blah. That even the good things don't mean anything. How does somebody motivate themselves to get back to their good habits, or how can we, as their practitioners or friends as family, help motivate people to, yes, you're suffering, but don't give up who you are. That's important.
Yeah, I think you're connecting to something right there too, like helping them to be reconnected to who they are as a person. What is it? Who are you holistically? What are the things that are important to you? What have been the things that have always been important to you? But I have to say, sometimes too, one of the best sort of strategies is to think about it as the first 5%, right? In any sort of movement forward, it's often the first 5% that is the most difficult. And so what is something that is an activity that could be engaged in just a bit, like just a little bit? Where can the motivation happen in just a piece to try to get some momentum, right? To try to get some momentum. When I talk with my students about it in terms of academic work, right? Because I'm in an academic setting, it's really the first 5% and the last 5% of any task that's very difficult. And if we think about our own lives and our own movement forward, right? Even just taking a walk, out to one block, and coming back. I mean, is there a very small step that can be taken in the direction that will get someone back to taking care of themselves.
And recovery from grieving isn't a linear process. You can like advance 2 steps and go back 2 or 3 or 1.
Right.
And then people feel I'm not getting over it. I was doing well for a couple of days and now I'm worse than I was before. But isn't that normal?
Oh, it's very normal. And I think if we think about death loss, we often talk about how grief is a reflection of love and attachment. And just because someone dies, it doesn't mean you stop loving them. So why would it mean that you would stop grieving? As long as there is a connection, there's grief. So if we think about it in our current sort of state of being, the losses connected to the pandemic, the more attached, the more we connected we were to those particular elements in our lives, the stronger the grief we will feel. And that will be a reflection of the initial attachment, the strength of that attachment.
So in other words, if you are grieving more, that means what you're grieving for, the person you're grieving for, must be somebody who you really love a lot.
Mm-hmm.
Because the loss is greater, but you've had the opportunity to share a portion of your life with somebody who you had that relationship with. Many people don't even have that. Yeah,
there is that piece to it. It's an indication of the substance, right, of the connection, the importance of it, the critical nature of it. And that has to do with people, but it also has to do with particular elements of our lives. If we think about who we are around multiple identities, there's some pieces of who we are in our lives and how we function that are bigger pieces of that identity sort of picture. And when those are affected by situations like the pandemic, it makes good sense then that our grief would be quite strong in relationship to the loss of those particular aspects of our lives.
I mean, I think for this is one of the most unsettling times for almost anybody. It's the pandemic, economic change, or the racial things that have come to a head that didn't just develop. It's been there for a long time, and the lack of uncertainty.
Yes.
Not knowing that is probably the most fearful thing to fear. We don't know what the future. We thought we knew, but that was an illusion anyway. But we thought we knew it, and we felt comfortable in. We always feel comfortable in our illusions.
Mm-hmm. Well, and we want control as human beings. As
It's
I
all
said,
about
control, coherence, and connectedness. And there's much we cannot control right now. But I think it's really important to find those pockets of control. And I think some of that is often where we'll see that irritability and that challenge around being around each other in some points, because some elements that we want to control don't connect well with the elements that other people need to control. But if we can have conversations about that process sort of level, like right now, I just need control over this. Right now I'm feeling really irritable because of this. Those sort of process level conversations can make a huge difference. I think you had talked about that, to be able to talk about the elephant in the room. Like right now, I'm really struggling because I can't have control over this. That is a really important statement to make when you're trying to be in relationship with someone else in the midst of such a challenging time that we have right now. And then the way that people make sense, the way they make meaning is going to be very different. But talking about those differences is really important, rather than judging the different ways that people might make sense. And then I still go back to the connectedness. The best predictor in terms of coping with disasters and massive challenging life events is really that ability to be connected with one another. But if we're having tension over control issues and we're having tension over coherence issues, the connectedness is also going to be very hard.
Well, it's great that you connected with us today and did this webinar. I grew up
really wonderful. Yeah, really wonderful.
In this family where the belief was children had to be a certain age before you could even talk about death with them.
Yep.
there was an expression which was in Yiddish. It was, don't tell the children that if somebody died, you went in the other room, you sent the kids in the other room, and you talk about it. So if I would ask my parents what happened to Uncle Sidney, he said, well, he's not coming to dinner anymore. Well, in retrospect, it's a lot more frightening that people could just disappear and out of nowhere.
Yeah.
As opposed to dealing with death. So and in those years, there was nothing related to any, let alone a course on death and dying. Mm-hmm. And I think that what you're doing serves such a great purpose, and it not only is something people should learn, not at the waiting for the end of life, but they should learn those skills throughout their life. Even children should learn about that.
Absolutely, I agree with that. As so for some of the physicians and dentists that are on the call, Heather, they would like to learn more. And so, do you have any recommendations for? These are people who have never probably read anything about death or dying, except perhaps maybe a book when a relative died or something, that that have to do with gain, loss, and grief. And is there something that you would recommend as like an intro, an introduction to reading, or possibly, something they could look at, a white paper, or obviously your papers, are all available online.
Well, one of the books, right? One of the books that I would recommend, and I don't have all the titles right in my mind, right? But two of my colleagues who are writing the chapter for us on non-death losses in the handbook, Darcy Harris, I believe her book is called Understanding Our Losses, Counting Our Losses. That's what her book is called, Counting Our Losses. And then my colleague Judith Murray out of Australia has a book about non-death losses, and I'm not going to remember the name of it, but Judith Murray is her name, and it has to do with non-death losses. Hers might be Understanding Losses, whereas Darcy's is Counting Our Losses. And they're both really excellent books talking about really using this concept of loss in a broad way. I think the uniqueness of our team is really bringing in that dynamic sort of dichotomous way of thinking about life events. But there's a lot of benefit from even just thinking about loss broader than death. It's very, again, validating and normalizing. And I mean, true. I mean, it's just really true in terms of how we move through the world. We experience gains and losses on a continual basis. And I think it's a helpful frame to accept and move through. And I would say in Asian cultures, they're way far ahead of us in this concept, way far ahead of more Western cultures in sort of looking at loss, looking at life in this balanced sort of way. Is an event desirable? Is it undesirable? Yes, it's one or the other. But can we experience losses connected to desirable events? Absolutely. Can we experience gains related to undesirable events that we never, ever would have wanted to occur? We can. As human beings, we're capable of it. And generally, we do. We are able to take in the lessons. We're able to learn about our lives. As my colleague Tom Attic says, we relearn the world. We relearn who we are in the midst of our grief.
That's really amazing. Thank you so much, Heather. I mean, this has been really profound. I think it's thought-provoking. There isn't anybody who's not walking away with out a much greater understanding and appreciation for what people are going through and what your work incorporates and how it can really help others in many facets of life and loss and ourselves. So we cannot thank you enough for this. This has been a really rare treat, and thank you again for coming. Howie?
And I know that when we first met, you were talking about the challenges that the school has in how do you bring students back, and so it's not only it's the same that all our businesses have of how do we deal with with people. How do we keep them safe, healthy, and how do we keep functioning as a business or as a university? So, but after listening to you, I am sure you'll figure it out.
Mm.
And,
Lots of challenges ahead.
Yeah.
And I think that when it comes back to how do we keep the humanity, right? How do we keep connected with one another?
That humanity is the constant. That as long as we keep that, we'll survive anything. So, Heather, thank you so much. I really enjoyed listening to you, and I could, we already ran over, but it's I just don't want to let you go. But Jordan, are you still there?
Yes, sir. And I just want to thank all the members for jumping in and attending. And, this discussion is just a real discussion that people are having everywhere. It's so nice to be part of it, in our associations and with our like-minded colleagues. So,
and I really appreciate the invitation. So, it's helpful to have these types of conversations with one another because there aren't that many pockets. So when we have the opportunity to make these discussions front and center, I think it's important that we take it.
Yes.
Great. Well, terrific.
Well, everyone enjoy the rest of their evening, have some relaxing moments, and really just spend time with people you love and care about.
Agreed.
Thank you, Jordan, and good night, Heather. Good night, Pat.
Good night, everybody. Thanks again. Take care.
All right, bye.
Bye-bye.
Bye.